Mary, earlier you asked about blind spots. We all have blind spots, areas we aren't able to see through because of what we've been conditioned to believe, either through social constructs or our own personal experience.
And you're saying you've had a blind spot with patients?
I know that either never experiencing abuse or trauma and having experienced it are in equal measure barriers to being able to address the issue with our patients. In my case, I would say it was my own experience, from my own life, my own story of growing up in an abusive household with parents who were abusive and violent with each other and with me. I blamed myself as a kid, and I continued to let that color how I saw others who were also dealing with violence. So when I say that none of us are immune, I include myself. So, we have put the evidence in your hands. The course directs you to many free tools and resources. I urge you to call upon your local SART or DV advocates. They are willing to help us with this, either in person or on the hotline. I can tell you that the physicians and the nurses and the allied health professionals who've managed to override the discomfort of asking are actually improving their patients' health, if not saving lives. And not all survivors are plagued with illness. Some of them become our best advocates because of what they know.
I think we need to spend more time doing role plays, getting more training, figuring out how to coordinate things in our offices.
I want that for all of us. I want us to hold ourselves accountable to our own biases, to be sensitive to what a patient or client is experiencing both in and outside of an examination room. We need each institution and every private practice to put policy, protocol, and procedure in place at every level, and to do so in a way that doesn't cause a survivor further harm. We need to do something before a protection order or a forensics kit is needed. We need to recognize child abuse sooner. We need to talk to teens about healthy relationships. We need to put assumptions aside. We need to worry about the safety of our elders, whether we work in an upscale private practice or a public clinic. And for the survivors and their families and friends who understand this need all too well, I applaud your courage and your strength. If there is to be a change, it is going to be because we made it. And it will be a major medical breakthrough.
Thank you, Dr. Gates. Thank you, Dr. Kahn.
Thank you.
Thank you, Mary, and thank you.